The prevalence of chronic coronary syndrome increases with age globally. While if I talk about in India, there is a rapidly growing burden of this condition, that is the coronary artery disease, which has become the leading cause of morbidity and mortality. Currently, it is the dual antiplatelet therapy which is recommended in the form of aspirin. However, new methods are still required for better management. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about a new drug which has been set as a standard for treating chronic coronary syndrome. The drug that I'm going to talk about today is rivaroxaban. Now, this has a low risk of drug interactions and it does not usually require regular monitoring for coagulation if it is given at fixed doses. Now, owing to its predictable pharmacokinetics and pharmacodynamics properties, when the tablet is usually taken oral, it is quickly observed and the maximum plasma concentration is achieved in 2 to 4 hours. Now, this has been reported in a recent review published in the Journal of Associations of Physicians of India. So, the trial that comes into picture is the COMPASS trial, which is a large trial including more than 27,000 patients with stable coronary artery disease or even a peripheral artery disease. Now, the participants were randomly assigned to either receive rivaroxaban, that was 2.5 milligrams twice daily, plus acetyl salicylic acid once daily, or rivaroxaban 5 milligrams twice daily alone, or acetyl salicylic acid once daily alone. The patients treated with rivaroxaban in combination with the acetyl salicylic acid experienced significant benefits compared with treating them with acetyl salicylic acid alone. So, after a mean follow-up of around 23 months, low-dose rivaroxaban in combination with the acetyl salicylic acid was significantly associated with lower rates of a composite of cardiovascular death, stroke, myocardial infarction than the acetyl salicylic acid group. Now, even though the bleeding risk was increased in the combination arm without a significant increase in the fatal or critical organ bleeding, combination therapy thus resulted in lowering the mortality as well as ischemic events compared to acetyl salicylic acid monotherapy. So, the consistent benefits of rivaroxaban added to the aspirin therapy were reported in patients with peripheral artery disease who were undergoing lower extremity revascularization. So, a total of 15,526 patients with a recent acute coronary syndrome were included. In this trial, rivaroxaban hence was found to be associated with a reduced risk of the composite endpoint of death from cardiovascular causes, myocardial infarction, or even stroke. So, rivaroxaban did increase the risk of major bleeding and intracranial hemorrhage, but not the risk of fatal bleeding. So, in conclusion, the clinical trial data on this new drug was certainly very encouraging, with evidence from the COMPASS trial and the pre-specified subgroups of the COMPASS trials, suggesting that the addition of rivaroxaban to aspirin was definitely associated with a significantly lower risk of ischemic events, mortality, as well as tolerable bleeding profiles in patients with chronic coronary syndrome as well as high-risk factors. So, this combination is definitely considered to be cost-effective and generally well tolerated in such patients who are having coronary artery disease or a peripheral artery disease condition, as well as patients with chronic coronary syndrome and multi-morbidity or high-risk populations. Therefore, on the basis of comorbidities and other risk factors, patients should definitely be individually evaluated for polypharmacy approach and cost while considering the addition of rivaroxaban to the ongoing therapy. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.